Hey, ideators and entrepreneurs, CUNY Startups here. Welcome to CUNY and Beyond, the podcast dedicated to helping aspiring entrepreneurs through storytelling. We're excited to dive into the entrepreneurial endeavors of CUNY students, alum, and bonus entrepreneurs who are willing to share their valuable insights with you. Join us for today's show.
I'm Gail Yankosik, your host for this episode of CUNY and Beyond, and I'm delighted to have as our guest Dr. Terry Huang. Terry is a professor and chair of the Center for Systems, the CUNY Center for Systems and Community Design, is the co-director of the NYU CUNY Prevention Research Center, and the founder of Firefly Innovations, which is what we're primarily going to talk about. Did I leave anything out? Because you have a very long list next to your name.
I'm the chair of the Department of Health Policy and Management.
Okay.
And director of the Center for Systems and Community Design.
Okay, I figured I'd leave something out because there's so much to it. Firefly Innovations, an amazing and important program, I think. I've been happy to be associated with it for several years as a mentor. And it brings such unique people into our world of CUNY and beyond. So tell us a little bit about what it is and how and why you started it.
Sure. Thank you for that question, Gail. So we started Firefly Innovations a little bit more than 3 years ago. And we envisioned it to be a very unique and well-differentiated public health entrepreneurship platform housed in a CEF-accredited school of public health. And it's both internally facing and externally facing. Internally, we have brought the entrepreneurial mindset and skill set into public health education. So we have courses on design thinking in public health. We have a hands-on course on public health entrepreneurship. And then we also have a new fellowship program on healthcare business innovation, which is a 2-year program for top students in our graduate school of public health and health policy who are interested in learning more about the intersection of public health and the private sector. So that's kind of the internally facing side. Externally, our flagship program is our summer accelerator on health equity. Mm-hmm. This is a very unique program because it's actually geared towards early stage startups from across the city, even across the country and across the world. Because the program is virtual, it's not geographically bound. The really unique thing about this is that we bring a very particular social determinants of health lens to the table. We want the ventures that we work with to have a really clear idea of how their solution will impact and improve health equity, in addition to being profitable at scale. And we also have a deep commitment to supporting women and underrepresented founders, which is also a very unique aspect to our program. And we've been very successful in attracting and supporting the kinds of founders and ventures that we set out to support. Yeah, the impetus for starting Firefly Innovations was really this long-standing recognition on my part and the part of many others in public health that public health really needs to be more agile and dynamic in fostering and scaling the innovation that comes out of public health research. The vast majority of public health R&D really never goes anywhere. Once a grant-funded project, once grant funding ends, the grant-funded project ends. And so most of our R&D, sits in, peer-reviewed publications in the ether that probably most people will never read. And, unfortunately, the consequence of this is that, there's so much innovation and clever ideas that come out of public health research, but then the output, doesn't really get scaled up to benefit the population out there. So we created this public health entrepreneurship platform called Firefly Innovations, to really solve that. And to do so, we need to bring public health research community together with the private sector, the startup ecosystem, and join forces. So it's very much a convergence. So I think that this marriage is really timely and so urgently needed in society, at large. And we hope that Firefly Innovations can really help shape this new paradigm, bring the fields together.
Entrepreneurship, public health sometimes does not sound as if it should go together. Did you ever have a moment where you said, no one's going to buy this idea? You're looking at people who make money and we're public health, we're trying to help. How did you get through that? Any doubt that you had or doubts of people you were talking this through with, that they could mesh, that this could be something that works and works well for everyone involved?
Sure. I think that those doubts, persist, among many people, both within public health and probably, within the private sector as well. And it is a constant, struggle that we have to address and overcome. But I do think that we have made some really good inroads. I think, we will eventually minimize, the doubts that are out there. It is true that, the traditional public health paradigm really kind of speaks to government and public sector action in addressing public health problems. But we also know that the real world is much more complex, and that the challenges that we face in public health, whether infectious or chronic diseases, are so multifactorial that the factors and actors that drive these problems and cause them to be persistent and difficult to solve really lie in all corners of society. Therefore, to solve these challenges, we really need to involve, actors from the academic side, from the public sector side, and from the private sector side. I think that the fact that we launched Firefly Innovations at the beginning of 2020, right before we knew that the pandemic was coming, in some ways, gave us a really strong argument, because once the pandemic hit, people began to realize, wow, to really tackle this, we're going to need the help of everybody in society. Government alone wasn't going to solve it. The rapid development of the mRNA vaccine would not have been possible if there wasn't already a strong foundation for public-private partnership. That's how it happened, right? A lot of the research was done in the public sector, but the public sector needed the manufacturing and distribution capabilities of the private sector in order to actually bring that, innovative product to scale. And so that is an example that I often reference.
You recently, I think it was recently, you brought on board Michael Short, who came from the private sector, if I'm correct. How has his position really helped you to move beyond your original thinking a little bit?
Yeah, so Michael and I actually met as fellow judges at the New York AI Venture Summit in 2022. And Michael caught my attention, because like you said, he did have a lot of private sector experience working with startups, and also, trained in public relations and marketing, so a lot of business development, experience and background. But he also had a CUNY history. He led some entrepreneurship programs at Medgar Evers College at CUNY. And so I knew that, okay, he would be able to really get integrated into, the sometimes unwieldy CUNY system, because
navigate the system,
quite easily. And he was available, and he was kind of in transition, between projects, kind of at the tail end of the pandemic. And so he was getting ready to move back to New York from upstate. So it was just kind of a nice alignment of all the factors, that made it possible for us to bring him on board. The focus of his role, of this role, as the managing director of Firefly Innovations, has shifted a little bit. The Summer Accelerator just launched a couple of weeks ago for the fourth annual cohort, which is very exciting. We've got an amazing group of ventures and founders. For Michael, one of his key tasks, in addition to keeping all of our programs going, one of the key tasks is for us as a platform to figure out a sustainable business model so that we can keep doing this, year after year. So there's a little bit more business development work within the scope of what I'm asking Michael to do. We're thinking about developing a incubator for CUNY graduate students from across different disciplines, as you and our audience may know, CUNY School of Public Health will eventually move into a health tech, life science campus that's going to be newly constructed in the Kips Bay area. Leveraging that new opportunity, there could be the potential for us to really scale and expand, Firefly Innovations. And as I mentioned earlier, we have an entrepreneurship course, for public health students. We can all agree that, you just get a lot more innovation when you have people with different experience and different disciplinary backgrounds come together. And so taking that course to that next level will require the curation of entrepreneurial teams with graduate students, from different disciplinary backgrounds. So that's something that we're really interested in developing. And so Michael's got a big task because he's helping us grow.
The Firefly Innovation Program is not limited just to CUNY students. Am I correct in saying that?
Yeah.
A cohort this semester, this summer, in India that we're working with.
Right. So the externally facing side of the platform is actually external to CUNY. Okay. So the Accelerator, which is our flagship program, 8-week intensive program every summer, is really geared towards startup businesses that already exist outside CUNY.
Right. Okay.
CUNY students can apply if they have an existing business, with a far along and enough a prototype. Right. But it's primarily geared towards outside ventures and founders. And so this year we have teams from all across the country, as well as one from India, as you noted.
Yeah. So, okay, I wanted to be clear on that because for those people watching us, and some of our students who, as you say, they may not be quite ready yet, but it's something for them to look forward to doing. I have a deep appreciation for this program, as I do for CUNY Startups, that you're looking to bring graduate students into this. This is, a great idea, and I wish you all the luck with that because I look forward to it.
Thank you. And I should note that, we have had CUNY startup graduates joining our accelerator program in, years past.
But thank you. I know this is a busy time for you. When is it? Never a busy time. But as a mentor in your program this summer, I have to say that it's a delight to be able to talk to you and get a little bit of the backstory of this project, how it started, where it came from. And selfishly, I hope it goes on for a very long time.
Thank you. And we are so deeply grateful for your continuous support for our programs.
Strangers come together, and after a week, they're almost best friends because they each can finish a sentence. We all find ourselves, well, what did I leave out? It's just an incredible program in that it just meshes together so many people who didn't know each other before 2 weeks ago, and we're already relying on each other and making sure that we cover each other if we've left something out for the founders. So it's great. And CUNY Startups, which is a separate program because they use this current students, it's the same way. It's just a real wonderful collection of minds and energy, and it's terrific. So I'm just very, as you can tell, I'm a big fan. I'm a huge fan. So
thank you so much. Yeah, we're at the end of the day, we're trying to build a community and ecosystem of like-minded individuals, but with different talents, different backgrounds, to collectively impact public health and create a better society for all of us and our children.
And I won't lose my focus. Whoa, this I know it's in my soul.